This is from Garg, Bantle, Henry, and Coulston, who is also an author of the previous one. And again, if you just Google effects of varying carbohydrate and a couple of the authors, you'll come to the study. The full title is Effects of Varying Carbohydrate Content of Diet in Patients with Non-Insulin Dependent Diabetes Mellitus. And the article concludes, in diabetic patients, high carbohydrate diets compared with high-fat diets caused persistent deterioration of glycemic control and accentuation of hyperinsulinemia. Hyperinsulinemia is higher quantities of insulin in the bloodstream, as well as increased plasma triglyceride and very low-density lipoprotein cholesterol levels, which may not be desirable. So let's move on. This one is a very important article because it actually highlights a study that was done. And I'm not going to get into this article other than to read its title. And that is, it's a low-carbohydrate ketogenic diet to treat diabetes mellitus. It's written by Yancey, Foy, Chalecki, Vernon, and again, Dr. Eric C. Westman, a very important scholar in the diabetes industry, or we say diabetology. The last article this is from Kirk. So the actual article is entitled Restricted Carbohydrate Diets in Patients with Type 2 Diabetes, a meta-analysis. Now by meta-analysis that means taking a look at many articles written on one subject and then trying to do some sort of analysis on it. And from this one, the investigators searched for articles published in English between 1980 and 2006 regarding carbohydrate-restricted diets that included and reported separate results for adult, non-pregnant patients with type 2 diabetes. The conclusions are astounding. This meta-analysis indicates that lower carbohydrate diets can be beneficial in treating type 2 diabetes, not only because of improved glycemic control, but also because of potential salutary changes in the lipid profile. Improvements in fasting glucose, HbA1c, and triglycerides appear to result from even moderate decreases in carbohydrate intake. Diabetes mellitus is, in part, a disorder of carbohydrate metabolism that results in hyperglycemia. Carbohydrates are the component of the diet that exerts the greatest influence on postprandial, i.e. after eating a meal, blood glucose. Thus, it is logical that diets lower in carbohydrates would result in less hyperglycemia. That makes sense to me, and it makes sense to many of the doctors that I mentioned beforehand. Dr. Richard Bernstein, John Rollo from 1797, Richard Thomas Williamson, and Charles Purdy from 1897. So it's not just me saying this. And it's not just 6 studies, although these 6 studies are quite important. But rather in my book I go through at least 20 different studies and then provide a list of 200 studies that show the primeness, the effectiveness and efficiency of a low carbohydrate, high fat, moderate protein intake. Now, I admit that it's not easy, but it's simple. So beyond all sane doubt, beyond all doubt, beyond all reasonable doubt, beyond all unreasonable doubt, beyond all insane doubt, beyond doubt, a low carbohydrate diet is the best diet. That is, it is the best to optimize blood sugar known. If that changes, if there is any evidence to indicate otherwise, I will certainly write about it in the future, and I will stop doing a low carbohydrate diet. But for now, my health, and probably your health too, is much improved through a low carbohydrate, very low carbohydrate, high fat, medium protein diet. So I'd like to thank Cisco for providing the flip video that was used to make this video. Thank you very much. There'll be much more to come. Have a great day.